Hello, vets, and welcome back to C-4. This is show number 7, which is part 2 of our discussion on PTSD. Once again, my guests are back, Dr. Bridget Cantrell and Mr. Shad Meshad. Bridget, you've got a book. I'd like to hold it up so everybody can see it. It's called Downrange to Iraq and Back. Bridget, tell us just a little bit about the book.
Well, it's a book written for the troops that are currently serving in Iraq and Afghanistan, and it's written as much for them as it is for their families to help with the understanding the implications of being in a combat zone and what that might entail, as well as what the readjustment issues are when they get back. And I have people from all different eras reading this, and they find it very useful in terms of just helping to understand what to expect when their warrior comes home and how they can better be a part of a team to help them readjust in the best way possible. I
spoke to a gentleman down at the East LA Vet Center, a fellow named Manny Martinez, and he said that they have these books down there, and they're handing them out down there at the Vet Center. So that's a good deal. You've also got a new book on the horizon, I believe, and if we can get on that, here's what the cover will look like. It's Once a Warrior, and I'm sure that's another book that our vets should take a look at.
Right. I write with Chuck Dean, who is a Vietnam veteran from the 173rd Airborne, and Once a Warrior, Wired for Life is coming out on the 18th of August, and it's taking it a bit further from not just what PTSD is and combat operational stress, but what is it like now coming back, being a warrior and always a warrior, and how do you take those particular skills and hone them in so that you can bring them into a civilian situation and be successful in your life.
And you also have a workbook course for reintegration. I'll hold this up and tell us a little bit about that.
Well, that's called Turning Your Hearts Towards Home, and it's a structured workbook course. It consists of 12 chapters of various aspects of PTSD, anger issues, communication patterns, and all of those types of things that they struggle with. And it helps when they sit down with their loved ones in providing a format in which both the couple and the soldier can understand how they've been affected by the combat situation and what the expectations are and how to reestablish new expectations that are more realistic in their reunion.
Very good, very good. So we talked about a lot of interesting things on our first part of this PTSD discussion. I mentioned the vet centers. Shad, just so all our veteran viewers and all our viewers know, that you were there at the beginning of the vet centers. You were the man. You were the guy that got it going. You had a little help from a gentleman named Reverend Bill Mehidi, who I've met and is a tremendous guy. I wish he could be here today. What did Bill Mehidi bring to that?
First of all, he brought his writing skills. Many people, probably many that are watching the show, know Bill. He's an author many times over. But you know, when I was running the first vet center in America from like 71 to 79. You know, I was a street counselor, and I was strictly exclusive Vietnam vets. I sort of ran the city of L.A. Whenever there was TV or whatever, they'd always come to L.A., of course, Tinseltown, and they would always film my unit as to what was going on. But under Jimmy Carter, Max Cleland, in the mid-'70s, my work became well known, and then eventually the project was cloned. When I had to go to Washington, I knew Bill when he had left being a chaplain and he started working in benefits, where one of your other colleagues, Dave Culmer, was working. In fact, that's how I met Dave. I met them both at the same time. Mm-hmm. And when I had to go to Washington, I had to look a little less street because I had a full-on afro and beard and a lot of four-letter words.
I've seen those pictures
and
too.
And Bill and I had gotten close because I had vets that needed benefits, even though they were having emotional issues. You know, we treat the whole vet, and hopefully we still do. And when the time came, when I went to Washington that time, they brought me back. He said, we got to write the program. Well, I needed a writer, and Bill was my friend, so I took Bill back with me, and we both, with his help, wrote what became known as the Vet Center program. It was basically my program put into writing that I had in Los Angeles.
Right.
And Public Law 9622 eventually got voted on in June of '79. And by September, we started our first trainings in St. Louis, and we started training around the country for the next several years. And since then, I mean, he's written several books. He's done a lot with campuses. Came back into the chaplaincy for the VA and actually retired several years ago as a VA chaplain, and is still doing consulting with the VA, particularly with the overwhelming number of Iraqi and Afghanistan vets coming back with problems.
Right.
So he's the greatest.
He is the greatest. On our previous show, we discussed levels of PTSD and disorders, psychological disorders that exist that are not necessarily PTSD, but are not normal, that are brought back from a combat situation by a lot of soldiers becoming veterans. Let's talk about some of those other psychological disorders.
Well, readjustment is a big word. I mean, everybody, whether you're a rape victim, a torture victim, a 9/11 survivor, you could go on, the tsunami, Katrina, have readjustment issues. And trauma, particularly in war victims, there's always trauma involved. So there's some level of, we say PTSD, but not, as we were saying in the early show, full-blown PTSD, but symptoms. And we have to be very careful because everybody doesn't necessarily have what we define today as PTSD. They may have 2 or 3 or 4 symptoms. And usually those are worked out over 6 to 18 months. People eventually readjust, either on their own or with some help, nothing major. There is that percentage, as we found out in the big study that we did in the first 10 years of the Vet Center program, called the Readjustment Study, where we found out that no matter what war, 40% come back with severe readjustment problems, whether PTSD, full-blown, partial, mild, or whatever, and 60% move on. Like I said earlier, like you probably did. You know, you just moved on. You have a lot of memories. You have a lot of scars. I know you do, from the war, but you move on and get on with your life. So that's that 40% that we have. That 60% doesn't mean they came back and everything was hunky-dory. They just adjusted. Many of them could have went over there with issues, substance abuse issues, intimacy issues, all of the things that come with someone on the verge of going from adolescence to young adulthood, because that's where most of our soldiers are transitioning from.
Exactly.
So we have that whole multiplicity of diagnosis. What's happening today, quite similarly to what happened in Vietnam, is to stay away from the PTSD diagnosis because it costs major money. It's a reimbursable disability.
Right.
Whereas a character disorder, or today, personality disorder, is not reimbursable.
I was just going to ask that question. I'm glad you said that, because if you're diagnosed with PTSD, you could be compensated for a service-connected disability. If the person examining you says, well, this guy, he's just, you know, he's a little wound up, or he's got the old military case of the ass coming home with him, you know, everything kind of gets on his nerves. He doesn't like the civilians because they're just namby-pamby, whining about everything. And he goes, hey, you should have been where I was for the last year. You know, that kind of attitude. That's not a compensable disability.
Well, he's not going to get compensated.
No.
I'm not saying that's not part of a PTSD individual that actually has real PTSD, but he's probably going to be diagnosed with a personality disorder.
Right.
Pre-existing prior to going into the military, which creates a lot of interesting questions, as you can imagine.
Well, on that subject, there's this thing in the news that's been bouncing around about this young man who came out of Iraq. He was wounded there. He had hearing loss, headaches, memory problems, anxiety, and insomnia. Sounds like possibly TBI. Could that be TBI? It said 107 millimeter rocket blew 2 feet from his head. Okay, so I think we're talking probably TBI.
And PTSD.
And PTSD.
Possibly.
But the military, I'll read this. When he returned to the States seeking treatment for those wounds, the Army quickly discharged him, asserting his problems had been caused not by the war, but by a personality disorder that predated his military career.
I don't even have anything to say to that. That is totally absurd. I was expecting that somebody came back and exhibited some PTSD symptoms and they gave him a personality disorder. This is ridiculous.
And I deal with these guys directly. I just met a gentleman this weekend who has a traumatic brain injury. And one of his characteristics is very similar to PTSD. It's anger issues, impulsiveness, confusion, can't concentrate, can't sleep. High levels of anxiety, and so this is a tragedy.
It is.
And there's more and more research. I mean, they're doing a lot of research now on TBIs, and they're looking at the impact of the explosions and the aftermath of the explosions, when that causes soft tissue damage to the internal organs, retinal detachments, and that type of thing, not to mention the brain injuries. And so this is going on every day. It doesn't matter how much hardware you have on you or anything. These things are going to happen, and for them to indicate that it's because of a personality disorder, this is a scapegoat situation here.
Right. Well, what about you take a young fella, 20 years old, and I know Shad said this, he's gone from adolescence to adulthood during his military career. 20 years old, I enter the military, and I've got some personality quirks that pre-existed all my life, but they've never surfaced. But they're there. I go to war, I see a number of horrific events, I'm traumatized, and all of a sudden, these quirks have kicked in. Is the military going to tell me that the war didn't cause that? If I would have just gone on with my life as a civilian, they might not have ever kicked in. I wouldn't have a problem.
Shouldn't be a question.
It shouldn't be a question.
First of all, trauma is trauma, regardless of what your personality was. Any personality, we're all personalities. We're all different personalities, can be traumatized. We know that. So the individual comes back. If he has trauma symptoms, regardless of whatever was pre-existing, personality-wise or whatever, he's got trauma. Right. And trauma was produced. These symptoms or these personality traits were there. It has nothing to do with trauma. They're two different things.
Right.
To say that this trauma occurred because he had these personality traits is ridiculous. Yeah. There's no research to back that up. They just do it and then put the onus on the soldier to file a claim, right, or to fight the claim. And it's ridiculous.
It is.
It's totally absurd.
We're going to take a break. Don't go away. More to come on C-4.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Enjoy your freedom. Support combat wounded veterans. Presented by the Military Order of the Purple Heart. For more information, visit www.purpleheart.org.
C-4, we are back. What do we know about service-connected disability compensation rates for returning veterans diagnosed with PTSD? Do we know, we know you get 10%, 20, 30, 40, 50. How does that schedule out?
That's really a crapshoot.
Well, they have guidelines that they go by, and I'm not a service officer, so I can't speak from that perspective, but I do know that it's a huge challenge with the veterans I see. And I might look at the criteria for this particular percentage of disability, and then we'll get a denial on it. Mm-hmm. So it is, and it depends on who the rating officers are and all sorts of stuff. And even if they have, sometimes buddy letters will help. Or I have a Marine who actually went on the website and got off the website like an after-action report that they have in the Army, where it will show KIAs and all the armaments they used and the situation at hand, and even in the names of the guys that were in the operation. He presented that as data, and they said they need more.
Really?
And so these things go on all the time, and it's getting more frustrating, not just for our Vietnam veterans, because they still are applying for their disability claims, and many of them, frankly, are becoming unraveled as they see this war go on and on. They've held it together all these years, and then they see these young kids go off to war and come back, and they know what they're faced with as they try to come back home, and it's very, very difficult for them as well. So they start becoming symptomatic themselves.
Yeah.
And so I have a lot of Vietnam vets that are applying for disability claims at this time. So it's a very difficult situation.
It is. And do you ever find that you've done some criteria on a particular individual, and in your mind you're feeling this should be 50% or this should be 70%, and it ends up being much less?
Right. I mean, I can't say, oh yeah, you're going to get blah, blah, blah.
No,
but
you can't.
No, of course not. But I can certainly see. I know this man very, very well. And maybe I've been treating him for a while, or maybe I've only seen him once, and he needs help. And I know that he meets the criteria. His whole life has fallen apart. He has a history of poor employment records, whatever relationship problems, drug and alcohol abuse, and he just can't fit back in. And so right there, he meets the criteria for a disability claim, and it comes back denied oftentimes.
So is it safe to say or fair to say that the soldier applying should not expect a good surprise? It will more likely be a bad surprise.
Well, it's a surprise any way you look at it at this point.
Absolutely.
Don't be optimistic.
Yeah.
Don't be optimistic.
Yeah. Don't be building your life around the fact that you're going to get what you deserve.
Exactly. Exactly. You know, I'd like to talk about, with Bridget especially here, because I know you've done a lot of work in this area, and Shad has too. What should family members look for in their returning soldiers when they come back into society and back into the family life?
Well, I think it's very, very important that this time we have to do it different than we did with the Vietnam vets. Like Shad said, many of you guys came home, you went into disguise because you didn't want anyone knowing you were a veteran. You wanted to try to disappear and just kind of meld into the framework because you were fighting your own war at home. And so now, hopefully, these family members will do what they can to learn as much as they can about what is it like to come home, what kind of challenges are our soldiers going to face when they get home. And so family members should look at signs of isolation. And I say, you know, isolation is good in small quantities because everybody needs some time to recharge their batteries. But if they see it's getting increasingly more, and maybe even that the buddies whom these guys really have a bond with aren't even able to reach their fellow buddy, their soldier that's come home, that means there's major problems, and those need to be looked at. The family members need to be afraid of or aware of domestic violence. It's on the increase. You can't just expect a warrior to come home from a war zone being trained to do their job effectively, and we know what their job is. Their job is to kill and to be a good warrior. You can't expect them to come home and turn off a light switch and all of a sudden all that goes away because they're in Los Angeles, California, or they're in Seattle, Washington. Those are intrinsic qualities of this person, and as you know, it goes, it's a reaction, it's trained, it comes almost first nature. So we have to really help the families be aware that this could potentially be a problem. And how do you communicate to this, how do you communicate to your warrior so that you don't trigger them? Or how do you know when they say, you know what, you need to back off here, I need some time to myself? You need to listen to that, and you need to allow this soldier time to regroup and be aware if there's an increase in drug or alcohol abuse, be aware if they're more snippy to the children, and just educate yourself as much as possible so that you can also be a partner in this whole process of reintegration.
Yeah, if they don't get this deprogramming program put in place, it puts so much pressure on the families. And it'd be a lot cheaper to spend a month or two of these soldiers prior to them being sent home than it would be sending them home and then hoping and talking, because it sounds great that, yeah, the families need to do this or that. How the family's going to get that information other through a show like this or a book like this or whatever. But the reality of it is there's so many coming back and going and coming back and going and coming back that probably the only way that's going to be managed is is while they're in, and letting them know they're going to go, because you're not going to have the money and time to work just with the soldiers and then with all the families. The families, hopefully will read our book, or there should be a network just that plays this around. It should be a show that runs every day, just like commercials, about some of the things to look for. Mm-hmm. The biggest thing, if the soldier's married or has a significant other, whatever, is intimacy issues. We know that is number one. Mm-hmm. Intimacy, because that is one thing that's lost in trauma, and that is the thing that destroys relationships.
And that's a scary part of the reintegration. Oftentimes the wives don't know who's coming home,
right,
and they're afraid of their spouse, or maybe they're having nightmares, or maybe they act out in the middle of the night. So it can be a scary situation. So that is an area that really needs to be looked at and addressed.
In your work with these veterans, do you see a difference between a soldier who returns to, let's say, a wife and children versus a veteran who just kind of returns to nobody?
Well, the pressure's on when you come to a family. There's so much responsibility. Not only when the soldier comes to the family, there's still readjustment issues. There's still all of these transitional issues that go on. But when you're sitting there with 2 kids and a wife and everybody just waiting for you to come back the way you took off, there's just so much pressure, and that's why we see a lot of the crazy things that are going on.
Right. But I would think that a family could be beneficial if they're educated.
Oh.
As opposed to a guy who really doesn't have any family, or maybe his parents are 3,000 miles away, or they're very old and they don't understand. He's alone, and
a lot of ifs. A lot of ifs.
Yeah.
If that was the case, absolutely. Coming back into a unit that's ready for him, as opposed, yes. It could be the other way around.
It could be, if they're not ready, it's going to backfire.
And then as Bridget was saying, too much isolation. You come back and you just move into an apartment, you just sit there and vegetate. You might wake up in 3 years saying, is it time now? Is it time now? Rather than a wife or somebody at least pushing you, going, are you going to go look today, or should we go to therapy or something? But it's all relative. It just depends on what occurs.
And that's another point too. Some of these units are brought home and they're not on near bases, so they don't have the cohesion of a military unit. So they could sit in their apartment for days and days on end and go on binges and whatever. And so that's why it's so important, if you are a veteran and you know of a young man who's come home, or a young woman, or you're an Iraqi vet, check on your buddy. Continue with the buddy system. It doesn't matter if you're still way across the country. You should keep in contact as much as possible.
Absolutely.
Sounds like a great idea. Folks, Shad, Dr. Cantrell, we're going to end this part 2, on our discussion on C-4, and we're going to come back and give you a part 3, which will be C-4 number 8. For Veterans Network, for C-4, Rick Seaman, out.